So welcome everyone. Welcome to Safe Summer Heat, Food and Mosquito Safety webinar hosted by Northern Eastern Public Health Unit or NEPHU and presented by Dr. Rehana Rico, Public Health Physician. My name is Muka Markovic and I'm the Engagement Officer here at NEPHU and I will be your chair for today's webinar. Next slide. Thank you. So before we start, I would like to acknowledge the traditional owners of the land of which we are meeting today and pay my respect to their eldest, past, present, and emerging. Next slide. So just a bit of a housekeeping. Today's webinar will provide community organizations and community leaders with an educational overview of extreme heat and heat-related illnesses, sun safety, summer food safety, and mosquito safety. We'll also provide communication resource to share with your communities to help spread awareness. All the resources, slides, and recording from today will be shared through email later on. We will allow plenty of time in the end, but you can ask questions anytime by writing them in the Q&A area, just as you can see just above. I will now pass to Dr. Rehana to take us through the overview. Thank you so much.
Thank you, Muka. Thanks for that introduction. My name is Dr. Rehana Rico. I'm a public health physician here at NEPHU. And I guess I just wanted to start by thanking all of you who've made the time to come here today and for your commitment to your communities. Thank you to anyone who's watching this in their spare time later. We just really have tremendous respect for the work you do and hope that you can learn something valuable out of today's session. So I've been asked to talk about 4 topics today, which we're going to sort of cram in a lot. The focus will be on extreme heat in the first instance, and we'll talk through that and some heat-related illness. And then I'll touch on sun safety and summer food safety and mosquito safety as we go. And I just want to recognise the topics are a little disconnected. So the transition, I'll prompt you at each point if you do have questions to feel free to put them in the Q&A, but we will just move through the topics and then definitely circle back to try and answer those questions at the end. So let's get started on extreme heat. So most of us, love summertime in Melbourne. It's a great opportunity to connect with our friends and our family and to get outdoors and hopefully be out of the office. And I think that's why it's such an important space for us as health sector and community leaders and organisations to be aware of how to really protect and empower our communities in this time, because we do know that unfortunately there are a lot of risks in summer, one of them being extreme heat. We know that extreme heat actually kills more Australians than all other natural hazards combined. And that's when we're comparing it to bushfires or floods or extreme cold events. So this is a really significant public health risk. What do we mean when we're talking about extreme heat? There's not actually one set temperature that defines extreme heat. It's really often discussed in terms of a heat wave where there's 3 or more days of high maximum and minimum temperatures, and that temperature is unusual for the given location. So there's a few things to unpack in that definition. And one of the important parts is that it's not just that the maximum temperature of the day is high, but even the minimum temperature is high. So usually we might have the opportunity to cool down and our bodies can cool down at night when the temperatures drop. But in heat waves, that minimum temperature stays high throughout the day and we don't really get an opportunity for recovery. The other part is that it's unusual. So we know that our bodies can what we call acclimatize or sort of get used to our normal temperatures day to day. And it's only when the temperatures start to rise from that normal that our bodies start to feel it. And that's why I say if in the UK, they might declare a heat wave when it's been 25 degrees for 3 days, whereas in Australia, we probably wouldn't feel uncomfortable till in the 30s. Extreme heat can have a number of impacts on our health, and we consider them in terms of the direct impact of the heat, but also those indirect impacts on things around us. So directly, the heat can cause a number of heat-related conditions, which we'll discuss today, and it can also worsen existing health conditions. But indirectly, it can also impact our health through disrupting essential services. We've often seen electricity failures, in the peak of summer, and whether that means your refrigeration's not working and your medications go off, or there might be increased hospital demand from a number of causes and you can't get in to see your doctor, you can't get the ambulance in time. So there can be a number of risks for people in extreme heat. And the result of that is we've seen that heat waves can kill. So even if we're looking at hospitalizations, there were over 2,150 heat-related hospitalizations in 2019 to 2022. And if we look here at this big orange arc, which is the whole 2,150, we can see most of those presentations are occurring in this older 65 years and over age group. And if we then break down into gender, we've got more than 1,400 of the 2,000 presentations were in males compared to females. So we're starting to see that there's different risk groups. Since the year 2000, heat waves in Australia, the deaths have largely been concentrated in Victoria and South Australia. And for Victoria, that's been largely attributed to two really extreme heat events in 2009 and 2014, where there were sort of 374 or 167 excess deaths attributed to the heat wave at that time. This is also a concern for us because we know that we are expecting more intense and extreme weather as the time goes on. We can see on this graph here that from 1910 over the years to 2020, we're experiencing more and more days each year where the heat is considered the top 1% of temperatures ever recorded, and that prediction is only going to increase. We also know that there are more deaths seen in El Nino years, and we're in an El Nino year at the moment, where the Bureau of Meteorology has declared that. And that's referring to a weather pattern that's happening in our Pacific Ocean around the winds and the water temperatures, and ultimately means for the east coast of Australia, we get really hot, dry temperatures and no rainfall, and that can cause more extreme heat events. And of course, climate change overlying all of this, we're probably going to see an exacerbation of all of these extreme weather patterns. So how do our bodies manage heat? Our bodies really like to control our temperature really tightly at that 37-degree mark and can allow for sort of plus or minus half a degree. But this is the temperature that our organ systems and our cellular function and everything just works best. Our bodies have a number of systems to regulate that temperature when there are sort of slight variations to the external temperature. And we'll talk through those now. So in this diagram, if there's a high external temperature, we know one of the first things we do is the body dilates the blood vessels and moves that blood closer to the skin so it can actually lose the heat through the skin. And you see people often look quite red when they're hot. We also start to produce sweat, which is that layer of sort of water and salts on the skin. And that allows, when a cool breeze moves over it, it facilitates faster cooling of the blood in our bodies. There are a number of other processes that help to decrease our metabolism so that we're not actually generating more internal energy. And we tend to reduce our movements when it's hot so that we're not creating more work and energy through our muscles as well. And so those systems can be really effective for sort of slight day-to-day temperature variations. But when the temperature is really hot for a long period of time, it can overwhelm these body systems. And what we get then is a spectrum of heat-related illnesses. If we think about some of the milder heat-related illnesses, you might have seen heat rash, typically in babies and children, that sort of blockage of or inflammation of the sweat glands and hair follicles. And this can be readily resolved with, cooling down and changing clothing. If we move a little bit up the spectrum, people can experience heat cramps, and that's when they've been sweating and they've lost salt from their body, and that actually affects the muscles' ability to relax. And typically people can experience those cramps in their abdomen or their arms or their legs. Moving further up the spectrum, heat exhaustion is then once we've been sweating for an excessive period of time, we've actually lost a lot of water and salts from our body and we've become dehydrated. And our blood volume is actually reduced, and that can affect our brain and heart functioning. And that can progress to heat stroke, which is a medical emergency. This is when the body cooling systems have really failed and that core temperature has risen. And this can cause widespread organ damage and is actually fatal in 80% of cases. So who is at risk of these adverse outcomes in extreme heat? It's really important for us to think about this in our own communities and consider how we might protect these individuals. Thinking about infants and young children and the elderly over 65 years and up. These groups often can either have sort of immature regulation mechanisms or aging and sort of failing age regulation mechanisms. People who are pregnant and breastfeeding also have a naturally higher body temperature during pregnancy, so they have less reserve when the temperatures externally go up as well. And also, if you can imagine, there's already fluid shifts and changes within the body in pregnancy that are more sensitive to that excess sweating and loss. We then think about people who have other chronic medical conditions like diabetes or heart disease or kidney disease, and also groups that might be on a number of medications that can impact our body's natural cooling mechanism. Some medications stop us from sweating. Some medications don't let our blood vessels dilate. Some medications, strategically help us get rid of water, but that could lead to dehydration more rapidly. Then research is showing us also that those who are socially isolated or geographically isolated do really worse in heat waves. That's because they don't have access to the same supports and networks. We also know that people with low socioeconomic status are at increased risk of adverse outcomes in heat waves, potentially not using their air conditioning or not having access to that secure cooling and housing. Then we also consider those outdoor workers and athletes who might be more exposed to the harsh climate. So what can we do? One of the first steps is to know the signs and to act fast. So this diagram I've sort of adapted for the Australian context based on the infographics from the CDC. But if we look at heat exhaustion on the left here in the first instance, remembering that this is the group who's been sweating excessively, they've lost a lot of fluid and salts, and their blood volume is depleted, they're going to start to feel dizzy. Their bodies signal extreme thirst because they're trying to replenish that volume. They're still sweating heavily, trying to cool themselves down, and their heart is working overtime and beating rapidly, trying to pump around that lowered blood volume, but they might look pale, and they often feel nauseated with weakness and cramps. So what we need to do then is move them to a cool, shaded area, lie them down, try and loosen any clothing and remove excess clothing. And if they're conscious, we want them to be sipping water to try to cool them down and rehydrate them. Soaking the patient in any available water or ice. If there's a bath, it's important to immerse them in a cold water bath, and really fanning the patient to help that airflow and removal of that temperature. If they're not improving within 10 minutes, that's when you would want to call 000 because heat exhaustion can lead to heat stroke. So if we're looking now at heat stroke, that's when the body temperature has risen to above 40.5 degrees Celsius. Now the organ systems are severely compromised and starting to shut down. People are often mentally confused and delirious. Now their system is no longer working and they're not sweating anymore. Their skin is dry and they're not putting out any effective sort of response. They might start vomiting and staggering. They might develop seizures or even become unconscious. Again, I reiterate, it's a medical emergency. We need to move them into a cooler area, lie them down, remove those excess clothing. If they are conscious, we can encourage them to drink water. Again, soaking their bodies. You can focus on places like the neck or the armpits or the groin where the blood vessels lie closest to the skin. There's large vessels and they can cool down faster. If they're unconscious, turning them onto their side, and if they have no pulse, performing CPR. But I'm sure most of you are like me in this sort of public health sphere, thinking surely there's a better way we can do this than just knowing what the signs of heat stroke and heat exhaustion are and how to treat it. Shouldn't we be doing something before it gets to that scenario? And it's this age-old question of, wouldn't it be better to build a fence at the top of the hill rather than be the ambulance down in the valley? So this is where we can act as the health sector, the community organisations, community leaders. Let's help our communities prepare before the heat wave. These are some key steps we can take to support the vulnerable individuals who are going to be most impacted. Helping them stay informed is really important, whether that's encouraging subscription to weather alerts, helping them access low-cost thermometers for the house to actually know what their temperatures are. Recommending that these groups seek medical or health professional advice before a heat wave to talk through their medications, understand their risks, understand any medication management plans that they might be able to enact in a heat wave. Really helping people identify and nominate support during these periods, whether that's family or friends or neighbours, and if they're really isolated, linking them into other services like the Vulnerable Persons Register that might be able to provide that check-in service for them. helping people to then prepare their home to be a cool space, whether that's by making sure they have air conditioning, or do they qualify for concessions to get that air conditioning? Do they have water ready in the fridge? Are their fans working? Do they have good curtains? And if we think that their homes are not going to be a cool and safe space for them, can you help them identify other public spaces that they could spend those heatwave sort of times in that are air conditioned, like shopping centres or libraries or movie theatres? The other part of educating our communities is about how to then respond safely in a heat wave. And these infographics are taken from the Departments of Health's Survive the Heat campaign of some of the core public health messages we really want to be promoting during this summer season. The first one is to stay hydrated, drink water. Even if people aren't feeling thirsty, they should be drinking water to replenish the fluids that they're losing and taking that water bottle with them. Another message that is you can never emphasize enough is that hot cars kill. So not leaving your children or your elderly or your pets in cars for any period of time, particularly during the summer, as the temperatures can rapidly double and become fatal in that scenario. And I think, we've seen it all too often on the news. Then the big principle of keeping cool. So this is again that seeking out air conditioned settings, closing the blinds that are facing the sun, using fans and cool showers, and dressing in light reflective clothing that's comfortable and breathable. Another good tip is to really plan ahead and look at your week and your day and think about what activities do I really need to do, and do I need to do them in the peak of heat, during the middle of the day, rescheduling things if you can, not booking appointments if you don't need to during that time. But if you do need to go out, planning again to take a hat and sunscreen and a water bottle. And a key message is about helping others. And it's that concept of that social connection that's actually protective for public health, making sure that you check in on your elderly family and neighbours and, run errands for them if you can, and helping people support each other during this time. So those are some of the heat topics that we've covered. I'll just pause and prompt you to, if you've got questions about that, pop them in the chat. You can navigate through some of the slides yourselves, but we'll now move on to sun protection and skin cancer overview. Skin cancer is common in Australia. We have one of the highest rates of skin cancer diagnoses in the world. And skin cancers account for the largest number of cancers that we diagnose in Australia every year, with about 2 out of every 3 Australians receiving a skin cancer diagnosis by the age of 70. So who's at risk of skin cancer? We know that 95% of skin cancers are caused by UV exposure, mostly from the sun. There is a genetic element of a family history that can increase your risk of skin cancers. And we also know that your skin type can increase or decrease your risk of skin cancer. And this is a busy picture, and you don't need to take in the details, but it's there to just show us that we do know that varying levels of pigmentation affect our skin cancer risk. In the lower pigmented group, or the fairer skin, they are typically more at risk of skin cancer. But studies have shown that in the darker pigmentation groups, they still do develop skin cancer, and sometimes these can be actually detected at a later and more troublesome stage because maybe they haven't been detected earlier. We also have behavioural risk factors that can increase our risk of skin cancer, and that's related to how much time we spend outdoors in the sun and our sun protective behaviours, and if people are using solariums, which have now been outlawed in Australia. There are a few different types of skin cancer. So we do have a basal cell carcinoma, which is the most common and least dangerous form of skin cancer in Australia. It's typically on the head and the neck and the upper body that's exposed to the UV. It can be sort of raised and scaly and ulcerate, and it can usually be treated quite easily in that outpatient setting. Then squamous cell carcinoma, or SCCs, is the next most common, and this can grow over weeks to months. And again, it's typically on the head and the neck and the forearms that are exposed to UV. But this one, it can spread to other parts of the body if it's not detected and treated early. And melanoma is the most dangerous form of skin cancer. It again can grow over weeks or months. It can come up as a new spot, but it can also come as an evolution of an existing freckle or mole, with a change in that the symmetry of it or the color, or whether it starts bleeding or looks a bit more irregular. If it's detected early, this can often be readily treatable in over 90% of cases, but if it's detected late, it can be aggressive and have spread to other parts of the body quickly. So again, what can we do for our communities? There are two important messages to reduce your risk of skin cancer, and that's to increase your sun protection and to check your skin regularly. So we would have all been familiar with the SunSmart campaign of Slip, Slop, Slap, and it has, been expanded over the recent years to include slipping on covering clothing, slopping on your sunscreen, slapping on a broad brim hat, seeking shade, and sliding on some sunglasses. We also want to encourage the idea of getting to know your own skin and checking it regularly. And that would really need that good exposure front and back, looking at hard to see areas like the bottoms of your feet or your fingernails in between your toes, and getting a sense of what's normal for you. And your healthcare professionals, or there are some companies that can also support you with this sort of mapping of your body. If things are detected early, there's really a good chance that we can prevent any late outcomes there, any difficult outcomes. So that's the sun safety topic. Again, put down any questions that you've got in the chat, and we'll move now on to food safety in summer. So food poisoning is quite common and affects about 4.1 million Australians each year. And we know this is more common and frequent in summer. And that's for a number of reasons. We see that the germs that cause food poisoning can rapidly multiply in the warm summer conditions. And then we couple that with our sort of summer behaviours where we're often out at picnics and we don't have access to refrigeration or really sort of good hand washing facilities. We're often leaving food out for hours on end and then having lots of leftovers. So these all increase the risk of food poisoning in summer. What is food poisoning? So that's really a name for a range of illnesses that are caused by eating or drinking contaminated food or drink. It's sometimes called foodborne illness or gastro, and it can be caused by a range of germs, so bacteria or the toxins that these bacteria produce or viruses. And the specific thing is that these bacteria or viruses have the ability to make us sick. Some of the ones we commonly see implicated in food poisoning is Salmonella or Campylobacter or norovirus. And the foods can become contaminated at a variety of stages through that sort of food production process, whether it's how it's being handled by those picking it or processing it or cooking it, or how it's being stored or how we're preparing it. And I might take a moment to note here that, in the wake of the pandemic, when hand sanitizer is everywhere, um, we can often see that people are using hand sanitizer, but unfortunately, the bugs that are most commonly implicated in food poisoning are not as effectively killed by hand sanitizer. And it's really soap and water and washing our hands that are the only effective methods for many of the bugs that cause gastro. So just remembering that when we're preparing food and handling food. So I don't think I need to spend too much time on the symptoms of food poisoning, as I'm sure we've all been unfortunate enough to experience this once or twice in our lives. But essentially, the symptoms can vary depending on the exact bug that's the cause. They typically range from nausea, vomiting, stomach cramps or diarrhea, fever and headache. The onset can be within a few hours or it can be a few days later after the meal. And the symptoms can range in severity from mild to severe, but typically last 2 to 5 days. If we want to think about who might be at risk of the worst outcomes from food poisoning, we need to consider pregnant women who already have, as we said, sort of fluid shifts in the body, and losing extra fluid through vomiting or diarrhea can be dangerous. And there are also some food poisoning bugs that can cross the placenta and affect the baby. And so there's lots of specific messaging out there around what people should eat to be safe in pregnancy. Also then considering young children and the elderly and those with other chronic medical conditions, they have sort of less reserve through their either immature sort of developed systems or blockages from the medications. And so vomiting and diarrhea can be more severe and pronounced in those groups. There are also certain foods that are more likely to cause food poisoning than others. And I'll call out here as well that contaminated food can often look or smell or taste normal. So that sort of taste test or sniff test isn't going to be reliable. And that's where we really need to rely on our food handling and food hygiene steps, as well as use by dates and reading food labels and cooking preparation instructions. Some of the foods that are commonly implicated in outbreaks or food poisoning include raw and undercooked meats and poultry. And this can be, if the animal's been infected or sick themselves, there can be bacteria within the meat. But also, if we sort of think about slaughterhouses and those processes, there can be lots of bodily fluids and cross contamination of the products at that time. And if that's not heated and treated effectively, that can cause food poisoning. Eggs and egg products, when raw, often can contain salmonella, and many of the flowers on our shopping shelves are uncooked and they can have bacteria as well. Unwashed fruits and vegetables may have bacteria or viruses on their peels, and that can penetrate the fruit before we eat it. Unpasteurized milks and raw milk products are another risk, where pasteurization is that process where we heat the milk for long enough to a high enough temperature to kill the bacteria within it. And if that process hasn't been undertaken, then there's more of a risk in those products. And then seafood is another one commonly implicated, particularly with shellfish and oysters and those sort of filter feeders that might sit in contaminated waters or oceans and actually concentrate the virus or the bacteria within their tissues and be a really potent dose. We can also think about some of those end products that tend to cause food poisoning more readily. So dairy products and deli meats, they can allow bacteria and viruses to rapidly multiply if left out. There are certain ready-to-eat foods like our sandwiches and rolls, which are usually cold and haven't gone through any heat processes and often sit out on a ledge or a shelf for hours at a time, and therefore they tend to pose more risk. Similarly, with those pre-cut fruit platters or pre-prepared cold salads like pasta or coleslaw. And then cooked rice or pasta can also have a risk if it's eaten a few days later and it hasn't been stored properly. So how can we promote important messages about food safety to our communities? What are the key steps they need to be mindful of? I've just tried to summarize them in a few key ideas here. The first one is really about keeping it clean. So this is washing our hands with soap and water, before and during and after meal prep, particularly around handling raw or uncooked meat products, and before eating. Making sure we're washing our utensils and our boards and rinsing our fruits and vegetables. There's a specific reminder here that it's not recommended to wash your meat and poultry before cooking. The bacteria can then sort of sit and coat the sink and actually cross-contaminate that way. Those products are best cooked directly from their packaging. Then thinking about keeping things separate, and that's really that concept of cross-contamination and avoiding cross-contamination, particularly around raw meats and poultry and cooked foods. So making sure people are aware and conscious of this through their shopping processes, through where they're storing it, making sure you're storing raw foods on lower shelves so that juices aren't dripping down to your cooked foods, and not sharing marinades, separating, your barbecue uncooked things when you're packing your cooler bags. And again, that idea of trying not to prepare food for other people if you're unwell and if you can avoid it, because any bacteria or viruses that might still be on our hands from toileting or being unwell, once that enters the food, that can then infect a group of people who consume that. Making things hot. So this idea of really cooking things to their appropriate high internal temperatures to actually kill any bacteria or viruses contained in the product is really important and a key step. And really a thermometer is the only way you're going to know. So investing in a low-cost thermometer is a valuable step. And then thinking about making sure we're heating our leftovers really thoroughly till they're piping hot. Again, if anything has been brewing, this can help to reduce the bacterial load. Then keeping things cool. So we know that germs grow rapidly in what's called the danger zone. So that's between 5 degrees to 60 degrees Celsius, which is easily achieved at room temperature. And so trying to keep things cool, whether you're shopping with your cooler bags or making sure you're thawing things in the fridge and not on the bench. And one of the issues making sure your fridge is at the right temperature is not to overstock it, as that can reduce the air circulation and temperatures can rise in your fridge. A few good rules of thumb for leftovers is to really refrigerate them within 2 hours of serving and plan to eat them within 3 to 5 days. And if you're not going to eat them in that time, then you can freeze them straight away and they can stay good for months. But essentially, if the food has been out of the fridge for more than 4 hours, it should be discarded as there's probably some nasties developing there. So we're on the home stretch. We're talking now about mosquito safety. So it's little known that worldwide, mosquitoes kill more people than any other creature. And that's often due to malaria, which fortunately we don't have here endemically in Australia. But in Australia, we do have over 300 species of mosquitoes. Now, most of them are just a harmless nuisance, but unfortunately, the two most common species that we find during summer are disease-spreading mosquitoes. And we are currently in mosquito breeding season here in Victoria, which is from November to late April. So you've probably already seen them around. How do mosquitoes spread disease? Well, we know that mosquitoes acquire their infection when they bite an infected animal, typically, and then they go on to spread that disease to humans when they bite us. So you can't catch mosquito-borne diseases directly from the host animal or from other people. They are only spread through the bite of an infected mosquito. So mosquitoes need water to breed. The eggs, though, can lie dormant for months waiting that right condition. And so while we are in that El Nino year that's really hot and dry, we do know that there's still water around from recent flooding, and that even one rain event might let that saturated soil bubble up with water, and then that will provide a nice environment for mosquitoes to emerge again. So we're not really safe this summer. The reason we worry about this is for the number of diseases that our mosquito population can spread. The most common that we see in Victoria are Ross River virus and Barmah forest virus, and these can often be experienced with no symptoms, but some people do get sort of joint aches and pains and a rash. We are also very concerned about Japanese encephalitis virus, Murray Valley encephalitis virus, and West Nile virus or Kunjun, which are rarer, but they can cause more serious illness. They can be experienced with no symptoms, but in some groups they can cause inflammation of the brain or an encephalitis, and that can have long-lasting consequences. We're also seeing an emergence in Victoria of Burley ulcer, which is caused by Mycobacterium ulcerans, and we're starting to understand more about it, that mosquitoes are actually playing a role in spreading this. And this is a soft tissue infection that can be quite a difficult and slow diagnosis, but readily treatable. And there's a campaign at the moment to raise awareness about this. It doesn't affect specifically within the NEPHU catchment, have not been recognised as high-risk zones, but people moving in and out of sort of areas where it's starting to be recognised might present to our practitioners. Fortunately, the mosquito populations we have in Victoria are not able to spread some of the more serious mosquito-borne diseases that we know of, such as dengue virus, chikungunya, malaria, Zika, or yellow fever. We may see these, though, from people who have travelled overseas and come back to Australia and then sort of develop the illness here, though they've been bitten overseas by an infected mosquito. But unfortunately, the predictions are because of climate change and extra travel, and we're having sort of flooding events and water birds moving around with different migratory patterns, we might see a change in our mosquito populations over the coming years that mean we're more at risk of some of these more serious mosquito-borne conditions, and we're really working hard at public health to try and prevent that from occurring. But what can we do? So the biggest way to protect your communities is for them not to get bitten in the first place. And so there's a Beat the Bite campaign from the Department of Health that we really want to amplify. So this is the first step, is to protect yourself from being bitten. So clothing choices are really important here. Mosquitoes tend to like shady, dark areas, so using light clothing can be a deterrent to them. Using loose-fitting clothing, where they're in tight clothes, they can actually bite through the clothes and still get to us, but the loose-fitting clothing provides a little bit of that barrier, and making sure we've covered as much of our arms and legs as possible. It's important to use mosquito repellents. These must contain either one of these active ingredients of DEET or picaridin, and those are the only ones that are effective against mosquitoes, and you can read the active ingredients when you're making your selection. There is only one vaccine preventable mosquito-borne disease, and this is a vaccine for Japanese encephalitis virus, and it's only available for certain high-risk groups, and it's related to their occupation and where they live, but certainly worth knowing about. We then want to make sure that we're protecting our babies and our young children, again, thinking about covering up their skin and using that loose, light clothing, but also the options for nets over their prams or their cots. There are repellents that are suitable for children, and you can look for the labeling around this, but again, making sure it contains that DEET or picaridin, and you can use it on their clothing instead of directly on their skin, and really trying to avoid using it on their hands, because we know that the babies will do the first thing and put their hands in their mouths. Then the next step is about mosquito proofing your home. And actually, under the regulation, all private property owners are responsible for managing mosquitoes on their property and reducing the mosquito populations. So the first aim is to not let them in. So making sure people's homes have good fly screens that are secure and intact, and actually using knockdown sprays if there are mosquitoes within the home. Mosquitoes love to breed in water, and they only need a little bit of water to breed. So it's really important people are vigilant at emptying out any stagnant water around their property. And this can just be collecting in toys or pot plants or discarded tires or pet bowls, and making sure people's rainwater tanks and pools are maintained and kept clean. Then thinking about these considerations, particularly when we're out and about on holiday. We know people in the summer will go camping or travel up, and far near North Queensland does have different mosquito populations that can actually be a different risk profile as well. So again, checking your accommodation. Do they have fly screens? Do they have nets? Taking repellent with you, as you may not be able to access it there. Packing that right clothing and seeking GP advice if you're traveling overseas, if there might be any mosquito related prevention you can access. So I know that's been a lot to cover. There's sort of a rapid recap slide here, which just highlights some of the key concepts again from all of those 4 topics. For extreme heat, we really think it's important that we at least first recognise that it is a public health risk, that we identify those vulnerable groups within our community, and that we try and prepare them before the heat wave and educate them how to respond safely within the heat wave. For sun safety, again, recognising that skin cancer is a leading cause of cancer in Australia, and that there are 2 key ways to reduce our risk, whether that be through reducing our UV exposure and increasing our protection, and checking our skin regularly. For food safety, again, recognising that the behaviours and the temperature increase risk of food poisoning in summer, and that we need to be using those steps to keeping things clean, washing our hands with warm soap and water, not cross-contaminating, making sure we're heating and cooking things appropriately, and then storing and refrigerating things appropriately, and discarding our leftovers after 4 hours. And for mosquito safety, understanding that being protecting your home with fly screens and sprays, and removing stagnant water. Excellent. Thank you so much for your attendance and your patience. And now I'll see if there's any questions or comments.
Thank you so much, Dr. Hannah, for this informative and engaging webinar. We have one question, and I welcome everyone to write the question in the Q&A area. And if you feel that it's easier for you to just raise your hand, you can raise your hand and I will unmute you and you'll be able to just ask. So the first question is, my understanding is that some antidepressants reduced heat tolerance. Can you comment on how it's related to risk, of for heat stroke or stress?
Yeah, that's a great question, and that there are lists of medications that can impact our heat tolerance for a variety of ways. I think it would be safest if we can send you some resources after the fact of the specific different medications. But certainly with antidepressants and antipsychotics as well, we know that they sometimes increase our internal core temperature and have a higher set point. So therefore we have that lower reserve when the external temperatures go up to be able to cope. So I think it's really important that we do start to have a working knowledge of the different medications that can impact our communities. And I'm very happy to take that specific question about antidepressants and send you some fact sheets if that's helpful.
Thank you. Let's see if we have any other questions. I actually have a question. Okay. Oh, yes. So not a question, just in terms of leftover food, you must not refreeze meat that has already been frozen. So yeah, that's a really good point. Can you talk a little bit about that? Can I take it out of the freezer, reheat it, and eat it again?
Excellent point. Yeah, exactly. So no is the recommendation. Once food has been thawed and used, then it should not be refrozen.
That's great. Thank you. And my question was around any other questions, please pop it in. We still have a few minutes for that. But my question was around sunscreen, sunscreen cream. I heard that you have chemical and physical sunscreen creams. What's better? What's good for kids? Do you have any kind of knowledge to share with us?
Sure. Yeah. So sunscreen, there are lots of different types out there on the market, and we know in terms of chemical or physical barriers, people think about zinc, which is see our cricketers with it often, and that really helps to sort of reflect the UV rays. The sunscreen has an additional component that can help absorb some of those UV rays. So the recommendation, or the minimum recommendation, is typically around sunscreen, not just zinc, and many sunscreens contain both. Sunscreens can have sort of different strengths. We will hear the terms of SPF, and that's that sun protection factor, and that's really just referring to how long it would technically take you to burn compared to if you weren't wearing that sunscreen. So, an SPF of 30, you'd technically take 30 times longer to get red than if you weren't wearing the sunscreen. And so we want a minimum of an SPF 30 when you're using sunscreen, though you can often see up to SPF 50, but in practice they're both extremely effective. There's only sort of a 2 or 3% difference in how much UV they absorb and reflect. So SPF 30 is the minimum recommendation. For babies, we would say under the age of 6 months, it's generally not recommended to sort of lavishly cover them in sunscreen. They might have more sensitive skin. So that's when we're thinking about the other ways to reduce their UV exposure, whether it's about not keeping them, not taking them out in the heat of the day, using hats and other physical barriers. There are sunscreens that are suitable, though, that you can apply sort of sparingly on the skin, and certainly you want to test in the first instance that they're not going to have an allergic reaction or an irritative reaction to them. But SPF 30 is the recommendation from the Cancer Council as a minimum.
Wonderful, thank you. Another interesting questions for organizations who run community events, and what temperature should we consider maybe canceling outdoor events to mitigate heat stress to participants and staff?
That's such a great question. I think that we would probably have to consider a number of factors in that, wouldn't it? Firstly, it would be about being signed up to those weather channels and weather alerts to start to be notified in advance if it's going to be declared a sort of extreme heat period. I wouldn't be able to give sort of an individual temperature. I think it would also then depend on what the event is and what the core population is going to be. Are they going to be elderly and frail? Are they a specific group with a specific illness set, or are they sort of young people and young families? And that would sort of guide the risk profile of the population that are attending that event. And then obviously thinking about what's the physical premise of the event, and is this just an open air, direct in the heat event versus if it's under marquees, or is it in an air conditioned setting? And then the timing of the day as well. And it might be that you could put in some mitigating factors, whether you're moving that to an earlier or later session, and whether you're cancelling or postponing. I think it's something that you probably want to really consider in advance, and it's great that you're starting to make those considerations and put together a plan. It is one of the recommendations for how businesses can help support their communities to start to piece together some of this work in advance about preparing your business, your staff continuity, and how you might modify and mitigate risks through events like this.
Thank you. We have a few more questions. If someone has an allergy to sunscreen, are there any alternative product that you can provide protection? Except the physical one, anything else you reckon?
Yeah, I mean, I'd have to, I don't have sort of an ins and outs knowledge of each sunscreen and exactly what their components would be. So I think it would probably be taken on a case by case basis if they have, if they've identified it's a specific reaction to one brand or the other. And then it's going to be about exploring, with the commercial actors, whether there are alternative low irritant sort of brands, or whether it's then more about taking some of the physical steps to reduce their exposure through other means, I suspect. Yeah.
Wonderful, thank you. Last question. Any advice on preparing the lunchbox for kids to prevent food poisoning on hot days?
Yeah, I think you've seen now the lunchboxes have gotten quite fancy, and there's often ice pack compartments and multiple sections. So some of the things, I mean, I guess some of the principles would be about considering some of those high-risk foods, so dairy and eggs and cold meats, and whether you avoid those in lunchboxes on those hot days. Sometimes you can actually put in the frozen pouch, for example, into the lunchbox so that it has time to thaw through the day rather than just putting in one directly from the fridge, and which will then just heat up through the day. And I think it's also the schools then have a bit of a responsibility about, the environment where the bags are kept in the classroom, that those are often temperature regulated as well. But I think having this knowledge of which foods are high risk will hopefully help people be able to then make choices for the lunchbox that might be less perishable and safer. So spreading those resources that really spell out what are the high risk foods could be helpful in that setting.
Wonderful, thank you. No more questions. I think we will continue to community resources. I'll just have a quick, next slide. I'll have a quick kind of summary of what we have. A lot of the resource here is what Dr. Rehana already talked about in the webinar. So very important campaigns, our Surviving the Heat campaign, and then multilingual posters. All of these links will be shared afterwards as well. And a video how to treat heat exhaustion. All of them will be, you're able to just press it. An important one is the SunSmart app that you can download to your phone, and really showing you, as you can see below, what's really you need to expect humidity and heat wise, and it gives you other information that's relevant for the day and for the 10 days ahead. Next one. Thank you. So food safety, very similar things. Food safety library of the Department of Health, and a few multilingual posters as well about food safety rules. A very engaging, very quick video how to avoid food poisoning. And yeah, another food safety guide, how to cook meat, eggs, and fish, all of the sensitive protein that Dr. Rehana talked about. Next one. And the mosquito safety, very important campaign that you can share, and the stakeholder kit, really kind of beat the bite. I'm sorry. Check it out. I think it will be very relevant to share kind of with families and community in general. Just next one. Wonderful. So before we go, we would love if you can take a moment and just scan this QR code and fill out a very quick feedback survey, not more than 2 minutes, and it will help us really design future events and webinar. So if you can just scan it now. Thank you so much. So thanks everyone for attending today's webinar. We greatly appreciate your attendance and participation, and a big thank you of Dr. Rehana de Rico for creating this great webinar. We are hoping to see you in next events, NEPHU events. And if you have any further questions, please do not hesitate and contact us on our email, the email that you got all of our latest updates, engagement@nephu.org.au. Thank you, everyone. I hope you have a great rest of the day.